Hi, everyone. Welcome to Perfect Prey. I'm so excited to be here today with Dr. Peter Salerno. We are going to talk about narcissism, and I'm really grateful if you haven't read his book yet, you want to get his book, Nature versus Nurture in Narcissism. He really unpacks all of the information, the leading literature that helps us to understand how these people become who they are. And I'm so grateful to have you here.
I'm grateful to be here. Thanks for having me.
Thank you. Thank you. Can you tell our listeners a little bit about you?
Yes, so I'm a licensed psychotherapist. Started out as a trauma specialist, just dealing with PTSD, complex PTSD, and developmental trauma, cumulative trauma. And then over time, I just started developing more of a specific population that I've worked with. Individuals were coming to me who were dealing with what is colloquially referred to as narcissistic abuse and psychopathic abuse and all of these terms that we're very familiar with. And I just started noticing this theme that I was like the third, fourth, or fifth therapist that they had seen. They were getting help, but they weren't getting like the help to actually fully recover and to put names to what was really going on after being in a relationship with someone who has a personality disorder. And the vocabulary was not being used to help them make sense of what they were going through. And so I just developed a really specific sort of treatment method to help individuals. One of the things I needed to do was to determine what's actually causing the personality pathology, because we've all been indoctrinated with this belief that the abuser is just one of the abused. So while that can be the case, that is absolutely not the reason for the abuse. And
Mm.
so I went on I was over a decade ago, I went on a long quest to try to understand if there was something in the clinical literature and the theories that we were missing about personality disorders. And it turns out that a lot of research and evidence from fields outside of psychology, neuroscience, neurobiology, behavioral genetics, and many more were identifying these types of disorders based on biology and recognizing the biological basis for a lot of these behaviors that so this whole genetic link or component that and genetic is also a confusing word, but this link that there's these sort of traits that are a little bit more fixed and hardwired and predisposed rather than them coming from the development of trauma only started to come to light. And it turns out a lot of this research is decades old and it just is not part of the popular worldview yet. Once I was able to help people understand and actually do a meta-analysis and research really what the cause of these disorders was, a lot of individuals were feeling a tremendous amount of relief and help because one, they started to realize I'm not causing this in my relationship. Two, I'm not necessarily so sure that I want to stay now because if it's not what we think it is and it's not going to change, that gives people, empowers them to have a different perspective. So that's how I'm at. Yeah.
So helpful, right? Because victims and survivors are often blaming themselves
Hmm.
and also have personality traits that make them want to work really hard to fix relationships matter
Sure.
to most of the people that are in these types of, for lack of a better word, harmful relationships. Yeah.
Yes, absolutely.
No, I appreciate that. I really appreciated learning more about the research from your book. The book is academic, but it's not dense. I feel like a really user-friendly read for
Yeah.
people to understand. And to your point, I guess I want to inquire, what do you think the problem is from a clinical perspective that people are seeing numerous therapists and
Mm.
not actually being able to heal? I have a theory, so I'm wondering what your theory is about that.
Even from my personal experience in my degree programs, we're not really given a lot of information about personality pathology or abnormal psychology. We're taught theory, and then we're taught how to implement those theory in clinical practice. But the population that we're trained to treat, it's understood that there's a collaborative capacity in those patients and those clients, that they have self-correcting capacity to a degree, that they have a desire to change, that they have problem solving capacity and that they're actually showing up to collaborate. And those assumptions have to be thrown out the window with personality disorders because of the way their brains are wired. It's a different wiring and it's not from experience, although experience can certainly amplify it. So basically, we're taught these theories in school, and they don't really talk about what happens like when somebody comes into your office that is non-compliant, combative, antagonistic, not cooperative, and doesn't actually think they have a problem. And what they've done is we've had this adverse childhood experience theory as this umbrella for all psychopathology. So if something's wrong, it was something that happened to you in your childhood at a crucial developmental stage that left like a gaping wound that needs to be filled through a corrective experience or an attachment repair experience in therapy. But then there's this population of individuals that it just really, those rules don't apply. But we're still saying they're just a bit more difficult, but they're still trauma victims. We just haven't really figured out why the trauma interventions don't work with them. And that's a big mistake. And I think that's just this persistent theory bias in psychological literature and now in the mainstream general media, because now we have access to psychological concepts and constructs online for free. And so you don't even really need to have a background in psychology to have access to all of this information. And so the interpretations are all over the place. There really is less of a, not that there has to be a strict boundary, but there really is less of a line between a lay person and an expert. And so people are just, whether it's well-meaning or not, we've all accepted this idea that trauma is the only reason anyone has any problems.
Right.
And if they are creating problems in someone else's life, it's a defensive strategy, not an offensive strategy. It's unconscious, it's never intentional. And these are myths that I'm hoping my book is discrediting, not based on my opinions, but based on the research that I've provided.
Yeah, so important. It feels empowering to me. When you said they come to you and now they get this different perspective, they realize that someone actually can't change, right? That this is who they are as a human being. It's almost, it feels okay, I have permission now to take care of me
Mhm.
instead of contributing constantly to supporting the relationship. And for my listeners, my own personal experiences, I went to several therapists and marriage therapy with an abuser. And
Yeah,
I was constantly gaslit into believing I needed to do more or I had anxiety. And there
right.
really wasn't an unpacking of the childhood trauma, and there was, but how many people have childhood trauma, right? Why is it that some people have it? And your point is some people have it and that they already have this predisposition to
Mhm.
be this harmful individual. And some people, of course, don't have the predisposition and they're not going to be perhaps harmful, right? Am I understanding that correctly?
Yeah. And what a lot of people in the general public aren't aware of is that across the world, we actually have treatment clinics that is designated specifically for the treatment of personality disorders. And the individuals who are in those facilities, what they've realized is there are just as many who don't have a traumatic background as there are who do. So we have to accept that rules out trauma as the cause
Hmm.
and that there was something else going on, maybe that was pre-morbid, not predetermined, but predisposed, that led to the development of the personality disorder in some individuals, but not in others, with identical environmental experiences or very similar. And this is across the world. It's not in one culture, it's not in one country. It's a global phenomenon. These traits are they're present everywhere in every part of the world. So
That was the part when you said that. I know that, of course, but it was to see that written out in your book that there are people who, regardless of traumatic experiences, this is who they are and this is who they're going to be. And that's a little bit, that's, I think, a little bit hard to swallow, like to,
yeah.
right? Yeah.
It's yeah, yeah.
Yeah.
And it also, I think what has been a little bit confusing for people is so if it's not trauma and it's not their upbringing that's causing them to be this way, then it's genetic. And then if it's genetic, then it's not their fault because they can't control their startup material. And it's not really 100% one or the other. It's always nature and nurture. There really isn't a way to distinguish the two. But again, it's like words that get thrown around a lot are regarding personality are like introvert and extrovert, for example. Now, you can throw an introvert into social situations all day long and you can make them do public speeches and you can make them be involved in big crowds. And there's still going to be that disposition, that desire to not be in that environment, right? They're going to select environments that more cater to their introversion, no matter how they were raised. And that's the same thing with personality disorders, is we're starting to understand that it has to do more with their traits than their personal experiences that are going to have them actually seek out environments that cater to those traits, just like an extrovert is going to seek out an environment that caters to that trait. And I think it's really hard for people to wrap their mind around that. And it's also hard for people to accept that these things potentially do run in families, especially if you have them in your family, then you start worrying about your children and future generations. But it's genetic means a lot more than inheritance patterns.
Mhm, mhm.
And there are some individuals with disorders that kind of don't run in families as well. And we have to start seeing genetic in a more broad sense than just it's passed on to every single person in the family and you're cursed if you have it and you're blessed if you don't. It's not the case.
You can imagine that all the protective mothers and fathers that I work with, one of their biggest concerns, right, is my child going to have these traits? And then oftentimes, children who are being coerced and controlled within the family dynamics and indoctrinated into a belief system that's not accurate about one parent over the other, it may actually seem to be taking on the traits. And you correct me if I'm wrong, I'm always coming from a place of there are some interventions that we can put in place that can support healthy ego development. And I start from, of course, the conversation of shame and really supporting a child to begin to feel that they can authentically be themselves, at least with one parent, even if they're behaving in sometimes the worst of ways.
Yeah.
I'm wondering your thoughts about that. That's about what I try to do oftentimes with protective parents.
Yeah, the way I look at it is the sooner you identify these features or characteristics, the sooner you can intervene. And so I would say that there's absolutely a chance of things of environmental influence and development and the nurture side playing a bigger role than it would had the characteristics be ignored. And I actually have some studies that I referenced in my book where there are certain therapies for children, not even like even before adolescence, that if they partake in them and they learn these new ways of thinking and they learn some flexibility, they've actually shown neuroimaging studies from before the therapy and after, and it shows that there's alterations in the structure and function for the better after the therapy in young children who have these tendencies. I'm never someone who's going to say you're doomed.
Right.
And so, no matter where you come from, I always believe there's hope, especially if you take responsibility for it sooner than later. And that's also a very hard thing to face.
Yeah, I think what I always say is that we just have to assume that if you were in an abusive relationship with someone who has these character traits, which I think, frankly, probably all abusers have these character traits, right? They're all interested in controlling other people and antagonistic, that just assume that you have to parent differently.
Yes,
I have moms tell me all the time that they had wished they had started some of my coaching when their children were younger. Because to your point, the sooner that we can parent differently, we have to really understand that the family, whether we're in the relationship, some people stay, right? Or whether we're out of it, we have to assume that there's harm being inflicted in some way and that those character traits will either be emboldened or not if the intervention is helpful.
absolutely.
Yeah,
Yeah.
it's a heartbreaking thing for parents. Oof.
Oh, absolutely. Yeah. It's a very heartbreaking thing to hear. You hear similar stories as me, and the work is very rewarding and fulfilling. But hearing how so many people on a regular basis very commonly get into relationships, assuming that the other person has the same intentions when they actually don't at all. They don't have intentions to collaborate and connect and attach. They have intentions to coerce and exploit. And then you have to wrap your mind around that. And then if you've started a family with someone like this, then you have to wrap your mind around you have children and you have a family system. And it's just such a harsh reality to have to face. And not even aside from the horrendous emotional and often physical abuse that takes place, just having to come to terms with something like that that you went into something with good intentions and you were sincere and you held up your end, and then it's a heartbreaking thing to hear, and it's very sad to know how common it is.
Yeah, I think that's actually helpful. Can you speak to the commonality of it? Because I think a lot of people are living in, you know what happens. A victim will share their experiences and people will say, is it really that bad? Or are you
Right,
sure? Are you sure? And then to the point about therapy, and not all abusers, right? Not all of these individuals show up in therapy
right.
out there. They actually are really good performers. Therapists can even miss the signs. They can not be clear about who actually is the abuser because oftentimes victims will be behaving out of character in
Yes.
these relationship dynamics, right?
Yeah,
Yeah.
absolutely. Yeah, I mean the prevalence of personality disorders is actually it's pretty high as far as the general. It's very high in the clinical population, but they're not going there saying, "Hey, I have a personality disorder, I need help." It's usually diagnosed after they've come in for something different. And so the clinical population is very high, and there's a high rate in the general population. So it's not to say that they're everywhere, but there are a lot of individuals with not so good intentions just walking around looking at everybody else. And oftentimes the victim survivor is the one who's trying to make sense of it. So they go to therapy. And if the therapist either doesn't believe in personality pathology, which many don't, they kind of group it all in again, like as trauma or even neurodivergence. Or so they're going to tell the person in front of them, maybe you have an attachment issue, or maybe you have a codependency issue, or maybe you have anxiety, or maybe if you stopped pointing the finger and dealt with your childhood trauma, then the relational dynamic would improve because what are you bringing to the table? And I've heard from countless individuals that they've
Mhm.
received these invalidating questions from professionals time and time again because there's almost this protective status. Nobody wants to believe that people intentionally exploit and antagonize and abuse, but if people do intentionally do those things, we do have to recognize it. And so we can't keep saying, if this is true and you're not exaggerating the abuse, it's because the other person is just abused like you and they're reenacting it. And so bring them in, which is a big mistake. Or, continue working on yourself and set boundaries. You can't set boundaries with someone who has intentions to violate them. I mean, it doesn't work.
Right.
So,
The victims and survivors I work with, right, they try to set boundaries, maybe escape the relationship. And then what happens is the abuse actually gets worse when they've left. Because, again, to your point, these people are not going to abide by boundaries. And they see that as, I'm not sure what you would call it, but they see it as an affront, as an attack on them. And
yeah.
therefore they have to retaliate. Sadly, most of the people I work with, it's protective parents who's these abusers have used the children, they've weaponized the children in these relationship dynamics. Yeah.
Yeah. I have worked with a lot of individuals who they're actually the victim of the abuse, but the abuser has found a way to get even the children to align with them, even temporarily, let's say. And so the person who is actually the victim is blamed for the dissolution of the marriage or the problems in the family system. And so it's incredible how much they can get away with through their performances, as you said, and their manipulation. And it's very sad.
It is. It
Yeah.
is. I appreciate the fact that there's more people talking about this. I want to just circle back a little bit to this idea that I think what happens with clients, right? And you've alluded to this too, or that they go into therapy and that oftentimes they get pathologized as having a set of problems that they need to work on.
Yeah.
And what would you say to victim survivors when they have that experience? I guess I say run for the hills. I'm like, that's not a therapist. That's not a therapist for you. You need to find a new therapist because it's like you need to find a therapist who understands this, truly understands it. That's what I say, but I don't know. What would you say to someone in that experience?
Yeah, I would say, yeah, it's probably a good idea to, I guess, shop around then. And sadly, sometimes you have to shop around quite a lot in order to find a good fit with somebody who really understands. I think as time goes on, though, this kind of specialization, if you will, it's going to become easier to find. And you alluded to the fact that you went through it. I did too, personally. And there was a time when I had such faith in the system because I'm a therapist that I'll hire some therapists. In my situation, I had a personal therapist. I hired one for my ex-partner, and then we had a couples one. All three unanimously identified me as the problem.
Mm.
And it wasn't until I provided solid evidence, hard evidence, that they were all unanimously terrified for me. And it was like, okay, we need to go back to the drawing board here. Maybe you need to get a lawyer and a restraining order and protect yourself here because it's like almost like you have to, sadly, with a lot of therapists, like you have to prove it to them that the other person is capable of this because they're really gonna try to like zero in on how they can repair you. And that makes sense to a degree because you're the patient, you're the person in the room, but there needs to be more of an awareness that when someone comes in and explains their situation, sometimes there's an urgency to take care of the safety of the person rather than to just try to solve attachment problems or anxiety related problems. There's more of an urgency to get the person safe and to validate them. And that's not as common as I wish it were.
Agreed. Agreed. I think also sometimes victim survivors don't even know they're suffering abuse, right? They
Oh,
don't
yeah.
even, right? And so they're gaslighting themselves, they're being
Right.
gaslit in this, and then they go into therapy and I do these clinician trainings and attorney trainings and coach trainings actually. And I always say the first thing we should be doing, the first line of defense when a client enters our office, I don't care for what. Please rule out abuse. We have to rule out abuse, whether it's happened in their family system, their family of origin, or it's happening now. But we don't do that. I think as a woman, when we go to the OBGYN now, they give us a domestic violence like assessment. But again, it's a violence assessment. It's
Right.
through the violent incident model, but at least it's something,
Yeah.
right? But we should be probably, of all therapists, should be doing an assessment as soon as people enter our office so
Yeah.
that we actually have something to base whatever their narrative is, feeling really anxious, not sleeping well, wondering why my husband or my partner is always angry with me. I'm trying to figure out what I could do better. That whole
Oh, yeah.
wanting to fix things. Yeah.
Absolutely. Yeah. And yeah, and to your point, a lot of people don't even realize that they are being abused or they haven't been taught that like forms of abuse that aren't physical are really abuse. The covert manipulation, the coercion, all those types of less physical instances of abuse that the brain and the nervous, they don't discriminate between those things. They're just as impactful. But a lot of people will say he or she is not an alcoholic, breaking stuff, or he or she is not hitting me. And that's not abuse. I'm not being abused. And that's part of the gaslighting.
Mhm.
Yeah.
Yeah. Yeah. Can you hold up your book again for our viewers and listeners? Yeah. So
Yeah,
that everybody
absolutely.
can see it. Yep. Nature and nurture and narcissism,
Mm.
understanding narcissism and where it comes from. Thank you so much, Dr. Salerno, for being here and appreciate it.
Thank you so much for having me.